If you happen to faint with no obvious reason, you may have experienced something called syncope. This is what happened to me when I was performing on stage in New York in 2003, whilst my wife watched from the audience. I had no idea at the time, but I had a very slow heartbeat, which caused me to faint. After a vigorous song and dance routine, I tried to say my next line, but nothing came out. Then I collapsed. My doctor found out that the cause was an arrhythmia, or an irregular heartbeat called bradycardia. I was immediately fitted with a pacemaker to keep my heart rate at a regular rhythm, and I have, thank goodness, been well ever since. Not everyone is as lucky. Syncope can be difficult to recognize, and it may take years before the true cause is diagnosed. Although my heartbeat is slow, some people suffer a faster than normal heartbeat. Arrhythmias cause a lack of blood flow to the brain, and this is why people lose consciousness and faint. Sometimes people fall when they black out, as I did. Rarely is it so public that you have such an audience. Often the patient or the doctor may not realize it was a faint, and just the cuts and bruises are treated. Sometimes patients, and even their doctors, think they are suffering from epilepsy. But falling, having a fit, or fainting can all be symptoms of a heart rhythm problem, and it can be hard for doctors to test what the true problem is without being there to see and test what happens at the time. For people who have fainted without an obvious cause, cardiologists, as heart experts, have recently changed the way patients should be treated. They now recommend using a heart rate monitor called an implantable loop recorder, an ILR, which is the size of a small memory stick, for patients where an irregular heartbeat could be causing syncope. This monitor can capture your heart's activities during the fainting episode and helps your doctor diagnose or rule out a more serious heart problem. Diagnosing and treating an irregular heart problem can be life-saving. On Valentine's Day this year, don't just think about love, but think about your heart and the heart of those you love. If you've experienced unexplained fainting or blackout episodes, talk to your doctor about it. Visit the STARS website, www.stars.org.uk, and read out the blackouts checklist for more information.